Hey, friends, and welcome back to another episode of Early Childhood Chats, the podcast. Andy Roszak with you as always. And today, Dr. Michelle Kelly is joining us. Dr. Michelle Kelly is a nurse, and she is specializing in all things biology, environment, stress, trauma, all sorts of great topics we're going to get into today. And, we often think about, obviously the day-to-day care that we provide for those children. But there's a whole bunch of other factors that go into ensuring that they're in a healthy, safe, and caring and nurturing environment. And part of that is, quite frankly, sometimes invisible to us, right? It's about the environment they're growing up in, the chemicals they're exposed to, the stress that's around them, the routines that are either existing or maybe the routines that are not existing, and how that really impacts childhood development. So we're going to be talking through a bunch of this stuff today. I'm so excited to have Dr. Kelly on the show. Thank you so much for being here. You're a very accomplished individual. I don't even know where to start with your bio here. A nurse, you're up at Villanova. You're active in environmental health issues. You've kind of done it all, and we really appreciate all the contributions you're making to the field. Obviously, I know I'm not going to do your introduction justice. Do you want to say hi to folks and tell them about who you are and your background?
Hi, everybody. My name is Michelle Kelly. I'm a pediatric and a neonatal nurse practitioner. I am a researcher that focuses on long-term outcomes of children born preterm, particularly how the influence of of environment, and by environment I mean their home environment, as well as the social and socioeconomic components of their environment. So how that all influences child development and their health and wellness. I teach at Villanova University, and I am also the co-director of the Mid-Atlantic Center for Children's Health and the Environment, which is the Region 3 Pediatric Environmental Health Specialty Unit. The cool things about Region 3 is that we are the only nurse-led PACU of the 10 PACUs in the United States. So we focus on children's environmental health, as well as family and reproductive environmental health. So we're not just looking at the child, but what happens to the mother and the family before the child is born.
Wow. I mean, it's a piece of the puzzle that, quite frankly, we often don't think about. So I'm really excited for the conversation today. And I've been fascinated. I've been kind of, geeking out, digging into your publications and your research, and quite frankly, learning a lot, because it's just something you don't think about. And really maintaining control of that environment and making some conscious decisions, even in those early stages of pregnancy, the trajectory that has on kids later in life, it's quite dramatic. And I don't think it's a link that's really fully appreciated. So tell folks, how did you get into this line of work? What kind of motivated you to study all this stuff and do all this research?
Well, I started as a pediatric nurse practitioner, and went from that to to the NICU, and started working as a neonatal nurse practitioner. And one of the things I realized when I was working in both of those environments is that those two specialties don't talk to each other real well. You would think they would, but they don't. Or one assumes they know what the other is doing, and there's some gaps. So that is what started this process for me, really trying to bridge the gap between the NICU and primary care. And then that's sort of morphed into, well, what about development? What about working memory? What about executive function? How can we help this? How can we improve this? And as the children that I initially studied have gotten older, I have started looking at them in older ages as well. But I keep coming back to what can we do? And by we, I mean healthcare providers, public health, early childhood educators. What can we all do to maximize potential and minimize vulnerabilities? Because that's really what we can do. When I first started speaking nationally and internationally about preterm birth and outcomes outside of the NICU, one of the first responses, and it's actually like a standard slide I use all the time now, is this bubble that says, well, I can't do anything about the fact that they were born preterm, so why do I care, right? And the reality is there are a lot of things in life we can't do much about, but we can, if we understand what the implications of that history component or social component is, we can intervene to maximize the potential of those kids. And that's really, where my focus has been, is what can we do um, to increase positive outcomes and to support the strengths that children have.
Well, and I was, again, reflecting on your publications, your research, it kind of dawned on me like preterm birth is, gosh, it's not just a NICU problem. It's really a lifelong factor. Isn't that crazy? I mean, you don't even think about it that way. At least I didn't.
Nobody does. I mean, and well, I won't say nobody. There's a handful of us who have been researching it, and more now. I've been doing my first preemie publications were probably in 2006, so it's been a solid 20 years now. And this conversation is at least easier to have now. We can start having better conversations. And when I talk to adolescents and adults who were born early, um, they often look at me and say, well, why didn't people know this? Well, why didn't people know this? And the reality is, we couldn't know it until we had enough survivors to really have a population that we could study. And that sounds harsh. And kids have been born early forever, and we've had survival. But if you put it in like a lifelong context, 60 years ago, JFK was president and had a baby in office who survived 2 days, and he was 34 weeks gestation. That's a survival rate, or that's a gestational age that today would have a 95% survival rate.
Wow.
And, Patrick Kennedy lived 2 days. His life changed premature care significantly because the focus really started to, we really had this renewed focus on preemies and how to treat them and how to improve their outcomes. So he changed a lot on being, not that he knew it at the time, but his life really did change a lot. But it kind of puts it in context, where this has really been the last 60 years where we've been able to, last 50 years, say. So really my lifetime that we've been able to really change the outcomes of kids born early, which means that we have the luxury of talking about long-term outcomes. And we have the luxury of talking about, okay, they survived now. So now how can we minimize the other vulnerabilities and maximize the strengths that they have?
Well, and you may have better data than me. In fact, I'm certain that you do. But the research that I was looking at says about 1 in 10 babies is born premature. Is that right? That seems like a lot. Holy moly!
It's been about 10% in the United States for the last 30 years.
Wow, that's a significant number. You got a lot of people to study.
It's a lot of kids, and worldwide the number ranges, but 10% is a pretty standard number. And 2/3 of kids that are born early without a biologic reason. So it's NICU nursing, neonatology. That's a specialty that's never going to go away because we haven't figured out how to stop babies from being born early. So you have some great job security in that. But it is a significant portion of the population. And with the survival rates being close to 95%, it means every school teacher, every early childhood education professional, every public health person, every family practice provider, every pediatrician is taking care of kids that were born early, and they probably don't know it.
Oh, yeah, 100%. Yeah. I remember, gosh, I'm going to date myself, but probably over 20 years ago, gosh, as a paramedic, I was basically detailed to the University of Chicago, and we did high risk NICU transports with the isolettes and all that.
Mm-hmm.
And a lot of times they would fly them on helicopters, but quite frankly, there was a lot of times that helicopters couldn't fly, or the transport wasn't
Mm-hmm.
that long to justify a helicopter. And those are some of the most harrowing transports I ever did as a paramedic. I mean, I don't know how you do it, Doc. My hat's off to you. I mean, you and your colleagues are you're really a special breed of nurse, and just the stuff that you have to do and quickly do. It's really my hats
Hmm.
off to all the great work and the success is there. That's a crazy survival rate. Almost
Hmm.
95%. Wow, that's really improved when you think about, like you said, just the last 30, 40 years. That's amazing.
Yeah. Hmm.
So, I think one of the unique things, outside of kind of medical professionals, some of the first groups really to see some of these downstream effects or impacts or characteristics are really our early childhood workforce, right? And all of a sudden you do have that preemie in your center who's a 2 month old infant, and you do start
Hmm.
noticing. I mean, everything can be affected, right? Respiratory functions, cardiovascular, mental health, neurodevelopment, all the things. And I don't know that we're all that in tune with some of the changes that folks do see out there, quite frankly, because we
Hmm.
just say, oh, it's another 2 month old baby coming in, but maybe we're not as appreciative or aware of some of the challenges that preemie baby may even have, right?
Hmm.
Because it's not like the old days. Like sometimes, my sister was born as a preemie, and she was a tiny, tiny little baby. In fact, somewhere there's a picture of her like next to a Coke can, and she's like, "That's." I mean, that
Hmm.
I say preemie, that's what I think, but obviously not all of them are born that tiny, right? So, um,
No, the majority of kids that are born early are born between 32 and 36 weeks of gestation. So of that 10%, 8% of that are 32 to 36 weekers. So they're those kids that you think of as being pretty good. They did pretty well. Maybe they spent 3 or 4 weeks in the NICU, but then they went home.
yeah,
And we really rely on the families a lot to be able to pick up differences. And sometimes families aren't equipped to do that. So if they have the luxury of being in an early childhood environment, so a daycare or a early childhood, early Head Start or Head Start, we're really looking for those professionals to help the family understand where that child might not be keeping up with their milestones, or that child might not be doing the things that you expect them to. And I, several years ago, I did focus groups with elementary school teachers and asking them what they knew about the kids that were born early in their classrooms. And the general sentiment was that they were waiting for the physicians and nurse practitioners, the healthcare providers, to identify problems.
mm,
When I asked the same question to the healthcare providers, they were like, well, school will let us know if they're not doing well developmentally.
right.
Right. So it's again that we have these two groups that are, and then you have the family, and it's really leaving the family out to dry.
Yeah.
And so, the early childhood, you know, those folks that are working in that environment, daycare centers and early Head Start and Head Start, they see kids every day. They have this vast experience of being able to say, you know what, the last five month olds that I took care of could do this, but yet Tommy can't,
Yeah.
or, and it's not to make again, it's not to make the child vulnerable, but it's to say to the parents, you know what, this one, he really needs to spend more time on his tummy when he's awake because his muscles really aren't developing well. So we really want to start thinking about, getting those chest muscles so that they can, start to pull up, or, um, have. I want you to mention this to the doctor or nurse practitioner when you see them the next time, or those types of cueings for family will really help them, empower them and help them move and feel secure in their questioning, because I think sometimes families think there's something wrong, but until someone says to them, yeah, you're right about this, they're unsure.
100%. And, I don't know why, but these kids, they don't come with a little instruction manual, right? So
No readout,
as a
no
new
digital
parent,
readout on their forehead. No.
can't we like put a QR code on these kids or something when they come out? Like we know what to do with them. But, and you're right, because the access to healthcare, I mean, how often are you really seen, I got a 2-year-old and a 5-year-old, like we go to the doctor, I don't know what, twice a year, maybe 3 times a year,
Mm-hmm.
whatever it is. But I'm sure in the world seeing our childcare professionals every single day. And if they're not
Hmm.
keeping up with, and I know keeping up is probably not the right term, but if they're not, you know, in a similar trajectory as the kids in their class.
Hmm.
Not that that can't be overcome, but it is something as a parent. Hey, I'd like you to note, like, hey, your child is needs some extra help in this, or have you noticed this at home, or whatever have
Yeah,
you. And the great thing, the kind of the light at the end of the tunnel is like the interventions can really make a difference, right? So if you catch it early, you intervene early. I mean, you can really make up for some of these deficits in a major way, so they don't turn into
absolutely.
lifelong deficits, which is just phenomenal news, right?
Hmm.
The other term that has been thrown around quite a lot lately is the whole ACE, right? The adverse childhood
Hmm.
experience, the adverse childhood event, whichever way you call it. And I appreciated your take on it, because a lot of times, like you hear ACE, you're like, oh, that kid was in a tornado, that kid was in an earthquake, that kid's parents got killed in a car crash. But like the way you're looking at the ACEs, it's a whole different lens on things, thinking about kind of that whole environment and what toxins and what other factors are coming to bear. Could you talk a little bit about kind of when you say adverse childhood experience event, like what that really means to you and through your research?
So when we think about it, we think about it as anything in that distal environment. So they're in their social or socioeconomic environment that adds stress to their lives. So a mom or a parent who is incarcerated is a stressor. A parent who is a single parent is a stressor. Um, if they don't have a good support system. Economics are a stressor if they don't have access to food and those types of things. But it's also smog and air quality and overall pollution. It's lead. We do a lot of work in West Virginia. There's a tremendous amount of homes in West Virginia that have lead paint. There are regions of Pennsylvania that actually have higher lead levels in their water than Flint, Michigan. And Flint, Michigan
Wow.
is always who we think of when we think about lead in the water. But there are counties in Pennsylvania that have higher, sustained higher levels of lead. So those environmental pieces add toxin that add stress to the biology component of the child. And that in turn adds stress to the emotional and the developmental components. So it's all intertwined. Um, uh, I love this eco biodevelopmental model, right? It's pulling all the pieces together. So it's their environment, it's their physical biology, but it's also the social structure. And there are times that we cannot do anything about the air pollution. We can't change the fact that a child lives in an inner city. Or I was in Hawaii recently and I learned the term VOG, which is volcanic smog.
Oh, geez.
Okay.
Wow.
Um, so those kind of things. And that's not something that me as a nurse practitioner, I'm not going to be able to change that. I'm not going to be able to change their environment. But there are some really cool ways to make um, box fan filters for homes, for bedrooms. So, you take box fans and you put uh, filters, like air conditioning filters on them,
Sure. Right. Yeah.
and they create a filter for a child, for a home or a bedroom, for room size. So if you have a child with asthma and there's a wildfire, there's something that's an inexpensive way to get that child's indoor air quality under control.
Hmm.
And that's an educational thing. There's a really cool downloadable uh, from the EPA cartoon about how to make the HEPA filters. It's got like two cartoon guys. It's really a neat little resource. But things like that, they all affect the environment. They affect the way that child grows and matures and develops. So it's what makes it hard to study, because they're so um, it's not like blood sugar, right? Blood sugar, if I add too much glucose,
Right.
it's a cause and effect kind of thing. But there are so many components that will affect development that sometimes it feels overwhelming because we don't know what to fix first. Um, and quite frankly, I'll take any step in a positive direction, right? So if that is, helping a family navigate the economics, that's a step in the right direction. If it's getting a family connected with social services and parenting lessons so that they can learn how to better, safer, care for their child, that's awesome, right? So any of those things that at the ground level that we can do to improve the experience for our parents and for our children, that will overall improve their health.
Well, and I go back to that 2024 study you had published in nursing research, looking at 55,000 children. I mean, it's wild.
Mhm.
What a sample size that is. And you used the eco bio developmental model. Can you kind of break that down in just plain language? What is this model? What did it look at? How's it different than some of the other stuff that was out there?
So they weren't all my participants, right? So that's the first thing.
That's a big IRB to get, right?
Right. So this was a data set that is nationally available. It's called the Ad Health data set, and we were able to look at some factors that they collected over time. And we used adverse childhood experiences. So they asked the 10 questions about adverse childhood experiences, and we use those to model toxic stress for a child because there's enough research out there that says that these are all connected and they increase the stress in a child. And the science guys can give you all the science about the HPA axis and all of that, and that's not me. But let's just say yes, puts the individual under stress. And then we also looked at school outcomes, so neurodevelopmental outcomes. And we could track that if you were born preterm and you had a certain amount of toxic stress, your school outcomes were affected. So, and by school outcomes, the things that we looked at were individualized education plans, repeating grades, these types of things. And so when you add toxic stress plus prematurity, plus poor impoverished economics. So we used a poverty scale, you add all of these things together and it affects your neurodevelopment. So it can affect how you function in school. And then we looked at the kids at a little bit older age and, this next group of kids. So we were able to track that what happens in childhood, if it continues into adolescence, it will continue to affect adulthood. And that's that model where it's actually this cyclical process where, we have adolescents and adults who maybe didn't meet their academic potential, which means they're not going to hit their hiring potential, which means they may, have situations where they have continued economic stress, continued lower educational attainment. We also know that kids that are born early are more likely to have children who are born early. So that cycle just keeps repeating. So it was a really neat study to be able to pull out some things with some big data and see if we could make it work.
100%. And I mean, kudos for I'm sure that took a long time to get all that data sorted and filtered and all that, but the results are really interesting. And, again, the other thing I keep coming back to is kind of like, you're not doomed, right? Like just
No.
because you're born in this environment doesn't mean this is going to be the life. Like you've got some really positive outcomes and stories that, you've been able to uncover with your research, just like, hey, and in fact, in many cases, if you're born in kind of a bad environment or you're born with a lot of these risk factors or a lot of this toxic stress and all that, in many ways, like the attention you get, the help you get is even more impactful than people that are kind of not facing those challenges, right? Which I think
Mm-hmm.
is a really interesting story to tell. And, and especially looking at our early Head Start and our Head Start programs, like truly the work you're doing every day with families really does matter. And you and I both know some of these kids, the happiest moments they have is when they're at the Head Start program, because let's be
Mm-hmm.
frank, sometimes they're not going home to the best, situations, environments, all that kind of stuff. So it was really inspiring to me just to show like, yeah, that you're not like doomed to a life of bad things. Like, in fact, if you get some help, you get some intervention, you get some good stuff going, like it can really propel you in a rocket ship kind of fashion, which was really cool to see, quite frankly.
Mhm. Yeah, the study we did looking at proximal environments, which is the family environment, and the you know we really were able to show with that if you had a positive um, day-to-day environment. So I'm going to include your early Head Start and your childcare environments within that.
Yeah.
If you have positive experiences there where it feels protective and secure, you really can change those internalizing and externalizing behaviors. So, that child preemies tend to be very sort of, they're not the hyperactive kid usually, they're the more quiet, reserved child. Um, and sometimes those tendencies, while on the surface look like a good thing, they actually can increase anxiety and depression and things like that later in life. So, if we can balance that and have kids in a childcare environment where they get to express themselves safely, where they get to be, um, they can explore their environment and feel safe, that's terrific, right? A positive environment can also reduce externalizing behaviors, which are those, loud, destructive, think more traditional, hyperactive disorder type of behaviors. And so they all play in together. And, from a early childhood perspective, the more you can model positive behaviors for families as well, that really they take that home with them.
Yeah.
They take the idea of it, right? Because you can be in an impoverished area, but if you go home to love, right? If you go home to an environment that's going to take that board book and read to the child, you know, everything that's been done with the Thousand Words Project and things like that, where which is not my work, but is fascinating to me. Where the more words a child hears, um, we the old uh, thought was it was always bedtime reading, right? You have to read to children before bedtime. Well, as a primary care provider, I always told parents, I don't care when you read to them.
Right.
I do not care if you are sitting in the school line, the car line, picking the kid up from the older kid up from school. Have a book in the car and read to the child while you're sitting in the car line, or whatever it is. I raised three children. I cannot imagine anything worse than trying to read to them before bedtime. It was just not in our process at all. Um, but I could read in the morning while they were eating breakfast, or I could read, at the softball field while somebody else was playing soft. You
Right.
find that time, and I think parents, some of them, they get so stuck in that you have to do X at this time and Y at this time. But if we model that behavior, that it doesn't matter as long as
Yeah.
it's getting done. Um, Parents will find creative ways to help their kids, because I truly believe that most parents want the best for their kids. And so
Yeah.
whatever that looks like, and I truly believe that most early childhood, providers and centers want to help kids and families thrive. So I am incredibly happy when I hear stories from families who say, "Oh, well, at preschool they told me to do this, and we tried it, and it really worked." Right? I love to see that follow through.
100%. And like as we always say, we really think our early childhood workforce is really the unsung heroes. And
Mm-hmm.
I know it's tedious work. I know it's not great pay. I know it's very, very labor intensive. But I got to tell you, like these are the things that the kids go home and talk about, right? It's
Mm-hmm.
Miss Amy and Miss Tina and what Miss Abby did today. Like you are the heroes for these kids, and that's truly what the
Absolutely.
families talk about every single day. And the impact that you make is it's probably more than you recognize, but you're doing a great job, and we love the fact that you're in the field. Please stay in the field. We need you here for sure. To that end too, I think you've hit the nail on the head. I think everyone really wants to do the right thing, but we may be some kind of naivete. We may not know the best things, and I'd kind of be remiss if I didn't take the opportunity to pick your brain a little bit on some environmental health factors. Now,
Hmm.
we all get like, hey, going around your program and throwing bleach everywhere, not the best idea, right? And for those friends in the
Hmm.
Virgin Islands, that goes for you and your fabuloso as well. Okay, we we just had Dr. Tess Wiskel on, and we talked about some of the physiological
Hmm.
differences. Like, kids are small, they've got higher breathing rates, they're lower to the ground, so they absorb more chemicals and these types of things. But I'm wondering, what are some other factors? What are some other kind of risk factors from an environmental health standpoint that are present every day in our childcare programs that maybe we're not even thinking about? Whether it's, I don't know, pesticides on the playground or other things that we may inadvertently be doing that you've seen in some of your other work that you've been involved in.
So, pesticides for sure. The other things that I think is going to be um, turf playing fields and the rubberized playing fields. They seem like such a great idea, but we have a lot of kids that have a lot of respiratory issues with those rubber play mat. The gym equipment that then
Yeah.
sits on the rubberized floor. Instead of the old mulch and dirt like in sand like we had when we were kids, which has its own issues. But there's some concerns with how that rubberized was made and what came out of it. For older kids, problems with turf fields are going to be an issue for a long time. My orthopedic colleagues are very concerned about the orthopedic injuries and the bone fractures and sprains and strains from those things.
Well, and it
Um,
seems like some of those, I mean, a lot of them are made out of recycled tires. And as a former
right.
firefighter, I'll tell you, they'll burn forever. I mean, that's dangerous if they catch fire. But also, I've seen a lot of kids like picking up the pieces. And of course, what do kids do? Right in the
Everything
mouth,
goes in their
right?
mouth. Yep.
Yeah. And that's
Yep.
probably not the best to be eating rubber tires, right?
No, no. I mean, none of that is good to go in your mouth. And just, that whole idea of everything at a child's level is going to go into their mouth. So,
Yeah.
and I know Tess covered these things, but like, the what are you cleaning with? Right. What's the drying time? So, those toys that you're wiping off with the purple wipes that are, incredibly toxic, really effective in killing bad germs, but also really nasty, right? We don't
Yeah.
want to use that and then hand it to the child, right? We want to make sure that they get set apart and dry adequately. Um, the other thing is second and third hand smoke is a big problem.
Oh,
So,
interesting.
um,
I
you
thought
know,
smoking would be gone by now, but honestly, with the vapes and everything
it's
else, it
not
just keeps coming back, doesn't it? I
right.
don't know how people afford it, very honestly, but
Yep.
huh. And
I
those
know.
vapes, in
And I
some
mean, and
cases, the vapes are even more dangerous than a cigarette from what the studies have been saying,
yes.
huh?
Yeah, I mean the vapes, the damage to your lungs when you superheat a chemical that is not supposed to be superheated, all of those flavored ones, right? And that's a probably more of an issue, an educational issue for um, to families, right? So that opportunity to educate families when they come in, and when you smell, and the caregiver who's picking them up today, you can smell the smoke coming off of them.
Yeah.
um, you know, that we've learned, secondhand smoke, was when we were sitting in restaurants and, somebody was smoking a table over, right? But third hand smoke is that smoke that you're carrying on your clothing. And then you pick up that young child and you cuddle them into your chest and they're breathing in that nicotine and smoke vapor is really, can be a significant trigger for respiratory problems for these kids. And
Wow.
once we start down that respiratory pathway, it becomes a self-fulfilling prophecy. There's some research coming out that says that a preterm child who has one hospital admission during their young childhood, so say 1 to 9, right? Um, if they have one hospital admission for a respiratory problem during that time period, their likelihood of developing COPD as an adult is exponentially higher.
Wow. Holy moly.
And whether so it's not causal, right? It's not that that admission caused the COPD, but the
Yeah.
need for that admission suggests that their lung issues are going to progress to a restrictive lung disease like COPD. So
Wow.
anything we can do to keep these kids vaccinated and, and clean air as much as possible is really, really important.
Yeah, it's not that long ago, but it seems like, it's like everything else. Like something happens, you kind of have a knee jerk and we go all the way to one direction. We
Mm-hmm.
eventually find center. But, we think about all the stuff that we did during COVID for cleaning and ventilation and air
Mm-hmm.
quality and all those things. And I see some of it when I'm out in the field. But it's faded, right? It's been several years
Mm-hmm.
now. And again, with our workforce and some of our programs having almost 50% annual turnover, we don't have the
Right.
longevity, right? Some of the staff that was there during COVID is long gone and have kind of forgotten the importance of the cleaning, the sanitization, the clean air, the indoor air quality. If our friend Dr. Dijak from NEHA was here, he'd talk about integrated pest management and making sure that we're
Mm-hmm.
pest free and cockroach free and all that kind of stuff, and allergens with cats and
Mm-hmm.
other kind of things. Yeah, it's kind of interesting to think about. Like we do need some really robust cleaning protocols. Uh, but then again, like, as you mentioned, we don't want to be getting out the bleach spray right in the middle of the classroom and
Right.
spraying kids as they're waking up from a nap or something. So making sure we have policies, and then we also have the time set aside
Mm-hmm.
to do these in a meaningful way is really helpful. And I just don't know. I don't know, with the stress of everything else going on and the staffing and the ratios and everything else. I don't know. I know
I
some
don't know how,
programs are, yeah, it's hard, right? I mean,
yeah,
there's a million things
it's
that are
hard.
competing right now. And that's why
And
we're
and
always
which
kind of looking for those quick wins. Like, what can I do today that would make us
right.
better and safer and healthier tomorrow? And some of this stuff does take a lot of time and thought to put into
Mm-hmm.
place, right?
Mm-hmm. I think having policies, is really important, and because I think too often some of those components become uh, secondary, and that's and because hierarchy of needs, right? We have to get the kids fed, we have to keep the kids safe, we have to do this, we have to do this. So worrying about whether or not we've tested our lead at the center, our water for lead in the center, or if we've
Right.
tested the soil for lead, or if we, are we using, or we know we know there's lead in the water in this community. We're supposed to be using filters. Oh, but I don't have time for that. So I'm just going to fill, like those kind of things. But understanding the why is really important. So sometimes that's going to be signage. Sometimes that's going to be, just reminding folks that this is why we have this policy. This is why we do what we do, is probably needs to be part of an everyday, of a routine process at the start of each year.
Well, I know that you mentioned you do a lot of mentoring with, students and doctoral students
Mm-hmm.
and everything else. What is the next generation looking at? There's a lot of new challenges that, quite frankly, they just weren't identified or researched or even talked about when you and I were kids, or
Mm-hmm.
certainly when you and I were in school. What are some of the new things that folks are looking at? Are they really looking at environmental health and different aspects? Are they looking at, the extreme heat, the weather change? Like, are they looking at all this kind of new and emerging research and stuff that's out there?
Yeah, I really think they are. I think the younger, this younger generation, because we're old now.
Right. Yes.
This younger generation is so much more aware of the environment's impact, and they've seen how flooding affects communities. How so I do think that there is an uptick and um, increase awareness and really asking good questions about how what we're doing today is affecting our health tomorrow. And I am always thrilled when people are asking that type of question, because we can't think about how what we do today affects us today. We need to think
Mhm.
about how what we do today affects our children tomorrow. So that's really, that thinking 3 steps ahead. That's the ICU nurse in me, right? I always have to think three
Right.
steps ahead, right? And it's that, that idea, and it's how I try and approach my research in terms of, what's going to matter to these kids and how can I make their health better and how can I help the health of the children, you know, to come be in a better place.
Well, and I wanted to pick your brain because I thought one of the comments that you had made was kind of astonishing, and it reflected on it quite a bit last night, actually. But you had equated kind of the war on obesity, right? Remember we did that in what, 98,
Mm-hmm.
99, whenever that was. And I know you have kind of written in the past about suggesting that, hey, we almost need to have like an awareness. I don't know if war is too strong of a word, but certainly like, preterm birth deserves that same kind of recognition and systemic recognition than we
Mm-hmm.
talked about with obesity. Are we anywhere closer to that? And I'm also thinking, as putting on your NICU hat, if
Mm-hmm.
I'm a childcare director and I know I've got a new family enrolling in my program and they've shared with me, like, oh, this was our child, the preterm, got out of the NICU. As you mentioned before, like we don't communicate all that great. And there's not like a formal hand, like you're never going to get a call from the NICU be like, oh, you're the child care director that's going to care for this kid that was in the NICU. Like, let me tell you everything you need to know. Like, we don't have that handoff,
Mm-hmm.
unfortunately. So I'm wondering if you have any, recommendations, advice, like what should that child care director or that teacher in the classroom, are there things they should be looking for, paying attention to, things that they should have on their radar?
They should all, so I think every program, every elementary school, every middle school should have a box on their intake form that asks whether the child was born early or not, and I'm not as concerned about whether they were 30 weeks or 32 weeks, right? Because we can't get that granular with it. I just want to know, were they born early, which is less than 37 weeks, right? And then that child should have a little extra attention paid towards their milestones.
Okay.
And that family should get more support and more education about what those milestones are. Because what happens too often is that there's this idea that, well, I'm assuming that somebody else is paying attention to it, right? So if we teach families to um, pay attention to those risks, so um, developmental milestones is probably the most important piece for early childhood, but also respiratory issues, right? So because that's what you're going to see earliest. Um, Blood pressure problems and things like that that may come up, they're going to come up later. That's going to be more your, middle school. That's a conversation for them. But for really the early childhood group, I really want to focus on developmental milestones and respiratory status. So if we see that a kid's having, you know, when you're changing the diaper and they're breathing and you see that their chest is pulling in a lot, they're working really hard to breathe. Um, Families need to know that's not a normal breathing pattern, right? That kids shouldn't be pulling in quite that much. And if they're struggling with some respiratory stuff, we want to get them back to their primary care provider to take a look at them. Um, doesn't, as long as they're pink and well perfused, it doesn't need to be this minute. It's not an emergency visit unless they're really working hard to breathe, right? But just even that, any type of respiratory stuff, you want to ask them, what's your primary care provider talking to you about this? Have they seen them they seen them recently? And the developmental milestones, really, your early childhood, educators are experts in what kids are supposed to do when, and use that strength and use that expertise and identify, what, this one's not keeping up quite the same. So maybe we should, ask the parent about it. Remind the parent, next time you see the pediatrician, we really want to ask them about this because this is different than somebody else. Um, and then just helping them, the early Head Start folks, you have OT and PT that's, might be incorporated in your programs, encouraging them to keep those appointments because sometimes we have kids that are born early and they're doing well enough and the family, because of all of the other life stressors, they don't keep up with those appointments. And truly those things are really about maximizing a kid's potential and, shifting that, being the change, the left turn that allows them to keep progressing, right? So if we can give them the strategies and the resources to break that cycle, we want to. So encouraging families to keep up with, those any developmental surveillance or any type of OTPT speech is really important.
Oh, that's phenomenal. Yeah, and sometimes it's just that, hey, remember this is important. Or remember, I mean, we've had some great stories over the years too of even programs that have been welcoming the health department. They come out and do lead screening of the kids right there on
Mm-hmm.
site because it's easy. The kids are already there, and
Yeah,
it's not one
yeah.
more transportation snafu or whatever, right? We can make it happen. So
Mm-hmm.
the oral
And
health
any,
obviously is great too.
yep, yep. Any So one of the missions of the PACEs, so the Pediatric Environmental Health Special Units, is that we do free education and support for communities, for families, for providers, for just about anybody. So if someone out there from an early childhood group says, I don't think we are doing the right thing about this, or I want to know how to do that better,
Yeah.
go to pacesu.net, find the PACU that covers your state, and email them. And if you can't figure it out, email me and I'll send you to the right people. Because that is part of our mission, right? And we want to be able to do that education. Our website has a ton of webinars teaching about education or about lead, about air quality, about all of these things. We're going to do a data centers one in the fall
Oh,
because that's
interesting. Huh.
become a big issue.
Yeah.
But so checking out those, the websites that are attached to any of the PACEs, they're posted for free. And, keeping yourselves educated about the environmental issues that are affecting your community is probably, one of the biggest pushes I will end with.
Yeah, no, I mean, I think that's fantastic. And certainly I know we did some work with the Region 2 PASU a while ago, but it was, basically when all these states started legalizing marijuana, and I think we're over half now. Yeah, I mean, it became an issue, right? Because now parents are showing
Mm-hmm.
up and you talk about second and third hand smoking on. Now they're showing up smelling like marijuana, maybe high as a
Yep.
kite. I don't know. And you get into this awkward situation. I wouldn't let a drunk parent pick up a kid and take him home. Am I going to let a high parent, pick up a kid and take him home? And it's, it can be really
Mm-hmm.
awkward, right? But,
Yeah.
and certainly like marijuana is not any safer than a cigarette, like, and a vape is not any safer than a cigarette either, by the way, right? So, um,
Mm-hmm.
I don't know. It's interesting to see all these kind of new and emerging issues that early childhood kind of finds itself at the intersection of not we're not asking for it, it just kind of comes to the door, right? So interesting stuff. So great, yeah, great plug. PASU is an awesome organization. I'm hoping we can get PASU to come down and for Puerto Rico for the conference and do a couple sessions. We did that, oh, I want to say 4 or 5 years ago, and it was really well received. So I'll keep working on that,
Okay.
and
Okay.
I'll buy you a pina colada if you and your colleagues come down. How about that?
Sure.
Great. Other ways people can stay in touch. You want to plug some of the great work the Mid Atlantic Center's doing? I know you've done a lot of great webinars and stuff coming up too.
Yeah. Yeah. So the easiest way to find our email address or our website address is kind of long, but if you just Google Villanova and Matchy, it's Macche, you'll find us. You'll find all of our webinars there. We have a fantastic lead screening or environmental list. So
Okay.
there are sometimes that we have families who have high lead levels and they can't figure out where the lead's coming from. Sometimes it's obvious, right? We know it's in the water or we know it's in the paint. But other times it's something that you didn't think of. And so on our website, we have a really fantastic and pretty comprehensive list of all of the questions to help folks figure out where the lead might be coming from in their environment. So that's a great resource that's there on the website. The webinars, our email and our contact information is there. If you're in Region 3, you can reach out to us. If you don't know which region to reach out to, you can always email us and we'll get you to the right folks and answer your questions if we can.
Absolutely. Well, thank you so much for being here. I was really fascinated to talk to you, and thank you again for all the research you've done and helping to advance the field. It's really cool to have some of the expertise that you bring to bear on this, and your background's really awesome too. So we really appreciate all you're doing. I hope everybody just kind of pauses and thinks about the children a little bit differently after this episode. And there may be some stuff that, you're seeing in your classrooms every day and you don't even realize where that behavior or where that is coming from. And maybe this is some of the stuff we've talked about today, right? But I really
Mhm.
appreciate it. Any final closing words for everybody?
Um, no, just keep asking the question, right? If you've got a kid you're worried about, ask them if they were born early.
Wonderful. Well, thank you again, Dr. Kelly. It's great to see you. Please say thank you to all your colleagues and for all the work that they do. And look forward to sharing more about all the great work that you guys have been up to in the future. We'll put all that links and everything in the show notes so it's easy to find for everybody.
Great.
And certainly
Okay.
appreciate everybody listening. It's great to have you. I hope you enjoyed the episode. I always learn, and I hope you do too. So I'll leave it here and say thank you very much. And I will see you on a future edition of the Early Childhood Chats podcast.